so bowel frequency, bowel urgency. When I say that, I'm talking about bowel movements. And then you've got the other side of it in terms of constipation, and then things like trapped wind and being gassy, burpy. And then you've got your stomach pains and your cramps as well. And then nausea and acid reflux, which people put down to their diet and things like that. Oh, because it's so limiting having digestive issues of, you know, whatever the symptoms might be, because you have to then think sometimes a bit differently about your life. Like I know of, you know, people where they've sort of thought, well, I'd love to do that activity, but actually that might be a trigger for me. So maybe I'll say no to that invitation, and that kind of thing. So it can be really difficult to adapt life into what would be their new life, because that's what they're processing when they, or before they come to me, to be fair, is trying to come to an acceptance of, okay, what's going to work, what's not, and figuring that out. And then obviously, luckily, when we go through the course of treatment, they then don't have to think about life like that, and it's just then obviously really liberating. Oh my gosh, 100%, because we know, and obviously common sense as well in this, that negative emotions, whatever they might be, have an effect on the body. And it's not just that, but so let's say you've already got those symptoms, and then because of your physical ailments, the stress and anxiety comes as a result of that. You didn't have any stress and anxiety before, let's say. And then what can happen as it perpetuates, you end up in this cycle of physical ailments, stress and anxiety, physical ailments, stress and anxiety, and you can't really get out of that rat race. Gosh, I think that goes into the physical affecting the mental, in terms of living with X, Y, and Z symptom. And obviously as time goes on and life becomes really difficult, and then obviously that affects you mentally and emotionally. And again, then that eats away. And so as time progresses, so you're getting hit on both sides really, and you're getting hit on that physical side and that mental side. But that mental side, and I think we kind of, because it's a physical issue, we don't kind of look at that, but needing to address the array of emotions that comes with living with a physical condition as well. It's not just the physicality of it, that is the disappointment, that could be the fear, that could be, you know, that could be the sadness, that could be desperation, you know, and all of that then takes its toll as well. So I think that's how people become affected psychologically from that. But also, if we flip it on its head and look at it as, could it be that the emotional side has created the physical side? Usually what happens, or, you know, from what clients say a lot of the time, is it starts off with one symptom. Now that one symptom could just be a little bit of a niggle, like that could be, apologies everybody if anyone's eating, that could be like they've noticed their stools are a bit softer, but that's nothing big, you know, it's not really causing them an issue. Maybe they need to buy more loo roll, but other than that, you know, their day-to-day hasn't really changed. Starts off as a really tiny niggle, and then that might develop as time goes on and nothing has been done about it. That might change into softer bowel, softer stools, but then a bit more frequency in bowel movements. So again, not too much different in their day, just need to go to the toilet a few more times, that kind of thing. But they're starting to think, you know, okay, well, this doesn't seem right, but maybe they're really busy and they haven't really given a thought to their body in that sense. And then that might develop into, oh, I've noticed I'm getting some pain now before I need to go to the toilet. And it just, you can see the progression and how it builds. So it doesn't normally start with a wham, bam, here, have 5 symptoms, and your body saying have that and, you know, deal with that. It is normally a gradual thing that people notice. Now, it might not just start with the one symptom, but what I'm saying is it will generally start off a little bit softer, kind of like someone poking you and going poke, poke, poke. And then that'll just develop. That wouldn't be, you know, straight away a slap in the face. That's just a little poke. And then you might get poked somewhere else, and then somewhere else, and just build up. And that would be how it changes. Yeah. Normally, the point when someone comes to me is when that has been a build up either of months or years sometimes. And they just can't take it anymore, that they're thinking there's got to be life better than this. So what can I find that's going to help me get better? Sometimes it is almost coming to me at a point of loss, like someone could have gone through the Western medicine approach, for instance, and for them, there's been no revelation, I guess, or progression in that kind of sense, whether it's with a diagnosis or medication that they've found, obviously nothing's going to work for them. So they're almost at the point where they're so fed up. It's like, well, you know, might as well give this a go, because what else am I going to do, you know? But I do also get people that come to me without having gone through the Western medicine stuff, just because they know in themselves that they feel that, oh, that's not going to help me. All the doctors will probably want to do is get me on medication, even if they manage to diagnose me with something, that they know they want to approach it from a holistic point of view, in terms of looking at it from an energy point of view, that there's something underlying in their body. It's not just a physical issue. There could be emotion behind that, and they want to approach it from that angle as well. Oh my gosh. Okay. So, I mean, I'm going back to quite some time ago. So my experience actually started, when I think about it, after a very traumatic event happened. And obviously all that trauma was then locked in my body. I didn't know this at the time at all, because sometimes we just think, you know, the past is the past and we move on. And it was then months afterwards, and I just started getting these random pains for no rhyme or reason. I was trying to work out a pattern. There wasn't one. Couldn't figure it out. And I went through the doctor stuff and all of that and different medications, and nothing was working. And eventually I luckily met a lady who suggested kinesiology, because she said my symptoms sounded very much like what hers were back in the day. And she said, she couldn't tell me too much about it, but she did say, oh, they can test you for foods. And I thought, if anything else, testing for foods would be absolutely brilliant, because by that point I was trying to work it out for myself, and it is so difficult. And by that point I was having a whole heap of symptoms. So it wasn't just the pain, it was probably everything you could think of, to be fair, in terms of gut issues. And I just went into kinesiology with an open mind, because there was no other option. And it really, really helped from the first session. So I then carried on and became a kinesiologist in the end. So it would be waking up in the morning, either because of my tummy or just waking up from my alarm or whatnot, and sort of doing a body check-in with my tummy and thinking, okay, am I feeling okay? What's going on? how long am I going to spend on the toilet this morning? Am I going to be late for work? So already all that anxiety has flooded in as soon as I've woken up. It would then be thinking, well, okay, I'll take this for lunch because that seems to be safe, although, I never know at 3 o'clock in the afternoon, a couple of hours after lunch, if I'm going to have a random attack of something going on with my tummy. And then feeling really disheartened over sort of the lack of dinner choices because I was trying to restrict my diet to play it safe with foods. And being a young woman at the time was really difficult, because that's normally, your prime time of your life. You're partying, you're socializing, meeting new people, all that kind of stuff. And I felt like I couldn't really do that. So I felt like I was majorly missing out on stuff. So again, there was, anxiety there over that. And, good old FOMO, I guess, is what people call it these days. Fear of missing out and sadness. And obviously I was grieving over the future that I thought I was going to have, but actually I was living in the present with all this horrid stuff going on and not knowing why. So yeah, not great to be living as me at that time. Through life, we get blocks in our energy pathways. Now, that could be caused by emotion, that could be caused by physical trauma, emotional trauma, that could be caused by environmental factors, whatever it might be. We end up getting blocks in our energy pathways. Now then, obviously the energy can't flow as it properly should. So when we get enough of those blocks, that is when something goes wrong, whether it is mental or physical or big or small. So what we have to do is clear out those blocks to allow the energy to flow as it should. So how we clear those blocks will differ, obviously, person to person. And this is where kinesiology is absolutely brilliant, because this is bespoke to each individual. Everyone's lived different lives, so everyone's got different stuff trapped in their body. So the idea is that obviously the body will completely guide the way subconsciously. It knows what's wrong, so it knows how to get better. So through the muscle testing or indicator muscle testing or muscle response testing, we are tapping into the subconscious to basically say to the body and communicate and be like, okay, hey, we've got these issues, tell us how to fix them. And that is literally what we're doing. And the body will pick out of, let's say, 100 corrections that I know, and it will say, okay, we need number 98 now to start with, and we're going to do this. And then we need a number 2. And then after that, we need a number 15. And it will literally pick, like ordering a Chinese, it will literally pick off the menu of all the library of corrections that I know what it needs to get better. So that is a simple way of describing what kinesiology does for gut issues and how it helps to heal them. A lot of the time people might feel a bit better after one session, but not always, but that's okay. And I always tell them not to panic, because the healing process is the healing process at the end of the day. And the amount of sessions needed to complete the course of treatment, again, will be different person to person. But what I do is I test out in the first session with the body how many sessions that person will need. One, for significant overall improvement, and 2, I test for when we would be done with all those issues. So how many sessions they would need for the entire treatment. So that gives them a really good guideline. But ultimately there are external factors as well that will affect that. If someone's had a really stressful week, then the healing process is going to take a little bit longer, just because the body is dealing with other stuff. So there are things like that, how well they've been sleeping, what their diet has been like. So of course those things are going to affect it. So it is really hard to answer that question, to be honest, because it is so individual. But there is comfort in the fact that, touch wood, I've had 100% success rate so far. So there is that. Caveat to that, when people have done their course of treatment and also done their homework, and by that, that could be if the body says, okay, you need to have 6 glasses of water by the end of the day, they've had their 6 glasses of water or something like that. You know, there are things that need to be done that I can't do for you. Depends how many questions you've got to ask. No, I mean, over the phone is always great because obviously any questions that come up for you can be answered there and then, and not get lost in an email train. But email is also another possibility, you know, if you're really busy, and then you can come back to it when you can. Or you've got, through social media, people come to me through Facebook or Instagram. So those are the common ways to get hold of me. Or text message, actually, I do get texts. But yeah, phone, email, Facebook, Instagram.